This program is all about knee mobility. So if you have found that you are still lacking in knee flexion or knee extension, this program is going to be what you want to be doing. But let's talk about what is the normal ranges of motion that you should be able to accomplish and what should you be working on or looking for. Now, the biggest thing that I always say with my clients is you want to be equal side to side. When there is a limitation from one side to the other, that's going to create compensations. So even if you have full extension of your knee, if you have hyperextension, that means your knee actually goes backwards a little bit more, say on your left side, and you only have 0 degrees or full extension on your right side, that's still actually not enough because your body is used to having that hyperextension. So you have to get the other side equal. And if you don't, there's going to be problems later down the road. You might not see it now, but it will creep up because step after step, day after day, year after year, that's going to compound on itself, and you're going to see, maybe more chronic issues later down the road. So it's super, super important that you get full knee range of motion to the best of your ability. That's flexion and extension. And then I'm also going to talk about tibial rotation, which you may not even know that your knee rotates a little bit. There is some knee rotation that is required for our body to operate properly, and sometimes a lot of people lack in that tibial rotation, and that might be a big cause of their lack of knee flexion or extension or just pain in general. So let's first look at the range of motion of the knee into flexion and extension. So I'm going to share my screen here. And this is what you're most commonly used to hearing about. These ranges of motions here. So full knee extension is that 0 degrees. That's how we measure that. However, if your other knee goes beyond the table and goes lower, you got to get that opposite knee to the same level. Knee flexion, normal range is about 140 to 150, depends on how much flexibility you have. A good marker is kind of seeing the distance between your butt. And so always compare side to side, injured side, non-injured side. You want to make them as equal as possible. And you should, some of you are going to be able to get to your butt. I can get to my butt, but that took a long time. So 140 is good range of motion, but you might not, you might have more than that, or your body might be used to more than that. So really, the main goal is that you work on making your legs as symmetrical as possible. Now let's talk about the less commonly talked about range of motion of the knee. Tibial rotation. So again, some of you probably have no idea that the knee rotates a little bit. The way that we look at this is having your knees straight. So this guy has his knees straight, whether his feet are pointed in or feet are pointed out. His knee slightly moves outward. But the key is that you're not actually rotating from the hip. You're only rotating from this bone right here, the shin bone. Okay. So you're going to be moving your foot inward and outward by moving your shin. That is called tibial rotation. And there's going to be exercises in this program that will help you mobilize this part of your leg to help you gain tibial rotation. Sometimes people's tibias don't move at all, and that's a big reason why they have issues in the knee, or they can't flex their knee fully or extend their knee fully, or they limp or walk funky. It's because they don't have the tibial rotation necessary to be able to do those things. So we are going to be addressing both of those things, but a good way to test is kind of seeing side to side, again, comparing sides, whether your feet are equal, pointed out, equal, pointed in, without actually moving your hips. Your hips don't move at all. Your knees should be pointed forward the entire time. So before you start this program, I want to make sure that you guys check that out and just see where your baseline is. But the whole goal of this program is to get you as symmetrical as possible so that you can be moving normally. So that is the goal of this knee mobility program.